Cleveland, Ohio is preparing for a surge of COVID-19 patients by converting a local university's health campus into a temporary hospital. Joining us now, CEO and president of the Cleveland Clinic, Dr. Tom Mihaljevic. Dr. Mihaljevic, thank you very much for being on. I'd like to start with the preparation at the Cleveland Clinic itself. You guys have been planning for several months to prepare for this. What prompted the early sort of ordering of supplies and getting everything in place?
Good morning, and thank you for having me. Yes, we here at the Cleveland Clinic have started our preparations in the beginning of January as we started noticing this pandemic spread from China. And we started to model and predict what would be the absolute largest number of patients that would be requiring our care here at the Cleveland Clinic. And in accordance with the model and predictive modeling that we have helped develop, we started to plan the allocation of all of our resources, people, space, and technology.
So, Dr. Mihaljevic, back in January, I think the president was still sort of paralleling this to the flu, called it a hoax. What prompted you? What information did you have that he didn't have that had you getting so very well prepared?
Well, it just came to our radar, the beginning of pandemic in China and the way that they were handling, and it became clear that if this were to come into the United States, that the large healthcare systems like ours have to start to think about how they would react to the pandemic.
Willie.
Doctor, it's Willie Geist. Thank you for coming on this morning. Can you talk to us a little bit about testing and why that's so critical, just to know how big the problem is, to understand the scope of the problem before you can begin to treat the problem?
Well, I have to say that to develop a large-scale testing that will serve all Americans in a relatively short period of time from the beginning of the pandemic until now is a formidable challenge on the best of circumstances. What we have done here at the Cleveland Clinic, we have developed an ability to test in-house. And by doing so, we have been able to provide our patients with the timely information about whether they are infected or not. Our turnaround time is 8 hours, although I have to say that our ability to test is finite, just like everything else. And currently, we're doing about 1,300 tests a day at the Cleveland Clinic. It is certainly...
You're doing 1,300?
Yes, please go ahead.
Well, so that's, I understand what you're doing at your hospital. You're doing what you can there. On a national level, though, because there has been so much talk that, you know, the numbers that are put out every day in terms of cases are exponentially higher than we actually know because we don't have enough testing to understand the scope of the problem and therefore how to treat it and what we'll need and how long this will last and everything that follows from that. So how do we scale up, I guess, a program like yours so that we can have enough testing in this country to understand the problem?
There are several components to it. First of all, we have to allow all laboratories in the large healthcare organizations that are capable of doing this testing to scale up their own ability. That is the way that we'll be able to multiply the testing to a number of different sites so that we can serve our patients in real time. And then we have to have a strategic approach to the necessary components of testing, meaning the technology and the reagents, the chemicals that we need in order to do the test.
Sir, Dr. Jeffrey Goldberg from The Atlantic has a question. Jeffrey?
Yeah, thank you, Mika. Doctor, I'm curious, you're a leader in American medicine. I would love to get your honest, blunt assessment of the American government response to date and the response of the Ohio leaders. Can you give us that?
Yeah. Yes, I think our federal government has obviously started to be more and more responsive with time. And I visited with several healthcare leaders, White House, several weeks ago, and I have to say that the response from CMS and an FDA has been very, very good as they've listened to us and they have taken our suggestions into account and they've implemented in a short order. Here in Ohio, We have started very, very early. Our governor has been very proactive. The measures of the social distancing were implemented early. And what I can share with you, at least over the last 4 or 5 days, as you know, as you can imagine, we measure the number of patients who are infected and track it on a daily basis. We are seeing some encouraging signs, meaning that the number of patients who are infected here in Ohio seems to be relatively stable, or it's growing at a relatively slow pace. We certainly hope that this trend will continue, but it's still too early to tell. We'll need another week or so to see whether we're flattening the curve effectively or not.
So, Doctor, before you go, given that you run this renowned hospital and you all saw this coming in January and began preparing, I'd like to ask you a little bit about the guidance that we're getting from the top level of the government. The 15 days to slow the spread has been moved to 30 days to slow the spread. Is that realistic, given what you know about this virus?
Well, the answer to that is it really depends about how effective our measures of social distancing are going to be. That will be, on one side, dependent upon when are they implemented. And the big unknown is how far has disease spread without us knowing before social distancing was put in place. So the timeline is really challenging. Our modeling predictions are telling us that if we are able to flatten the curve to some extent, we're expecting the peak of this disease, at least here in our home state of Ohio, to occur sometimes between mid-May and mid-June, with a gradual decline in the number of cases towards mid to late July. This is the best case scenario.
Best case scenario, mid-July. CEO and president of the Cleveland Clinic, Dr. Tom Mihaljevic, thank you so much for being on the show this morning.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.